Hello, bonjour. It's my pleasure to be speaking to you from Ottawa. I'm a family doctor here, and it's my pleasure this year to be talking with Dr. Victor Ng about how COVID-19 is challenging family medicine as a discipline, the four principles, and medical education. This is one of the numerous Besrour sessions at FMF. We have another session on implementation research during COVID-19, a record 25 number of posters from low and middle income country researchers, as well as a session by Dr. Samantha Green on social accountability. This session will help us look a little bit, continue to look beyond our discipline, which is the challenge at the current time. It's not just about the four principles, it's about how we fit into the wider health system. For example, we'll always be expert clinicians, but now we're being challenged to especially look after mental health. Will always be relationship-based, but what does that mean in virtual care? Community-based is, of course, still a given, but we are being challenged to integrate even more with public health. And we're conducting a study on what that means for COVID-19 vaccination campaigns. And perhaps most interestingly, what does it mean to have a defined practice in a global health emergency? What are the bounds of our responsibility when Africa will only be vaccinated fully in 2023? These are the questions that we will pose provocatively and give you some options to get involved. Hope to see you there.
Thank you, David. And I'm Victor Ng, Associate Director at the College of Family Physicians of Canada in the Department of Practice Support. And I'm excited to be working with David at the Besrour Center on this talk. As David has mentioned, certainly COVID-19 has had a profound effect on what we know as family medicine and the principles that we have committed to. In terms of education, I think it's going to be important to look at how virtual care and virtual pivots have changed education, both from a curriculum development and also an assessment perspective. Additionally, I think as faculty, we have to look at how ourselves are learning, thinking about the idea that we no longer have access to in-person sessions, and so much of what we are doing is online, and recognizing learning in non-traditional ways, and recognizing what is in fact scientific-based and evidence-based and what is perhaps not. And taking that knowledge that we've gained through some of these evolutions of COVID-19 and being able to package that and deliver them to students. So I think there's going to be a lot of exciting discussion. I hope that we'll have an interactive session along with David and be able to pair what has evolved in medical education along with how that has affected the four principles of family medicine. So we both invite you to our session. I think it's going to be wonderful, and we look forward to seeing you at FMF 2021.